Hi, everyone. Can you hear us on Zoom as well?
Yes.
Okay, perfect. Welcome, everyone. My name is Catherine Noble, and I am the Director of Community Volunteer Engagement here at Capital Caring. And first, I want to start by giving a shout out to all our volunteers. It is National Volunteer Appreciation Week, so if you see a volunteer, please thank them. And also a shout out to all our amazing social workers and other staff members who constantly support our volunteers to do the work that they do. It's a real team, and we appreciate you. So this week, we are hosting several events throughout the week just to get volunteers together, provide a little education, and provide some fun too, which we will be playing bocce ball here at headquarters outside this afternoon. So I hope you can join us for that as well. So today we're going to learn a little bit more about end-of-life doulas. A lot of you have seen some articles in newspapers, the Washington Post, People magazine just had an article. It's really a great opportunity for Capital Caring to be on the cutting edge and look into this, which we are, thanks to Jane here. Jane will introduce herself, tell you a little bit about her, but she just did a training for us for vigil training for end-of-life doulas, led the training along with Jane, and trained 31 of our Capital Caring volunteers to be vigil volunteers. Post-COVID, we definitely see a need for that extra training. We're now boots on the ground and bedside, so it's a great opportunity to have this training as well, to just figure out the questions that we all ask. What's the difference between an end-of-life doula and a vigil volunteer? And if I'm a staff member here, social worker or a grief counselor, how do I use these services? Who do I ask? What do I do? And what are the differences? So Jane's going to guide us through all that today. Thank you, Jane, for being here. And I'm going to throw it over to Jane.
Thank you, Catherine. So I'm Jane, and did any of you that are here now participate in the vigil training a few weeks ago? Anyone on Zoom?
Yes.
No. Okay. Well, we did have a great turnout, and I really appreciated being asked to be there and train folks that were really dedicated to this type of sacred sitting. We consider a vigil anywhere from 1 to 3 days before possible death. As you know, we don't really know when that is, but Catherine's already on the ball with that, and that's awesome. And she's asked me to come today to talk about what an end-of-life doula is, how it relates to the vigil, and what we're doing with and how it overlaps with vigils. And then also, doulas, as she just mentioned, are having their day. And, we're reading about articles about end-of-life doulas, several times a week in all the major papers. So just talking a little bit also about doulas in the hospice space. So first off, since I hadn't met all of you, again, my name is Jane, and I am one of 3 co-founders for a company called Present for You, which we affectionately refer to as PFY. I entered in this space, and by space, I mean the end-of-life care space, formally in 2018, although I had walked with friends, family, and 2 sets of parents at end-of-life before that. I took my first end-of-life doula training class in 2018. I took another one in 2019, and then I entered the palliative care master's program at the University of Maryland, Baltimore, and finished that in 2021. So I got invested in this, and I ended up retiring from a 32-year career in information technology to do this. I was also a Capital Caring Health volunteer, like you all, before the pandemic for a couple of years. And then I was also a No One Dies Alone volunteer at Fairfax Inova when that program was still up before COVID, before the world changed. And then I know some faces like Denise, I'm actually PRN's Capital Caring Health employee at Virginia Hospital Center as a hospital coordinator. So I think I've run into some of you there. So I work with that team at Virginia Hospital Center. So let's get done with all that out of the way. Let's get down to business. What exactly is an end-of-life doula? Right here. let me click on this. Right. So you may have heard doula in the birth space. It's a big thing. It's a trend to have a woman with you, providing emotional support during labor and delivery, a birth doula. I think the end of life doula movement is a few decades behind that. I don't know if you know that, but recently, birth doulas are being covered by Medicaid in several states because they have seen such better outcomes when you have support like that. So I'm hoping that, doulas or end-of-life doulas are going along that trend. They are recognized by the National Hospice and Palliative Organization. In fact, End-of-Life Doula Council was established in 2019. They define doulas as non-medical companions to the dying and their families who provide a wide range of holistic support complementary to hospice care. It's a little vague, and I think it's a little vague because you may or may not know that doulas are not licensed, we're not certified, we're not medical, we're not licensed grief counselors, we're not therapists, we're not chaplains, and we don't have an overseeing regulatory body. So it's a little bit of the Wild West out there when it comes to doulas. You can find, you can talk to 5 different doulas and they'll tell you their strengths and gifts, and it could all be different. So, but there are a couple of organizations that are trying to kind of make it a little more consistent, but I think we've got a ways to go. So right now you can take a class and call yourself an end-of-life doula. And as we talked about earlier, that doulas are having a moment because we're seeing articles on daily. And I think that's has a lot to do with COVID. We saw a lot of people dying alone during COVID, and people started talking about death and dying. And I think part of this movement was from that whole death positive movement that, we should normalize the discussion of death. And I know I'm preaching to the choir here. So I know that you all know these things, that normalizing, talking about death helps to normalize it. So, we're all going to die, right? So doulas can, these are some general things we can do. Just be present, companion the dying and their family, provide spiritual and emotional support, conversations. And I have bolded conversations because boy, people have stories and they want to tell their stories. And I think hearing a story, it can be very, provide hope, peace, and all of that. And so if you have time to sit and listen, people will, and interest, people will tell you their stories. And I have met some phenomenal people during this. I just think, everyday people are extraordinary. So everyone is, and everyone has a story, and I love to hear the stories. Help with legacy projects, tangible memory things, and I'll speak about that a little bit later. Provide education on the dying process with referrals and resources. I have I've been doing this since 2018. I have a whole group of folks that I refer to, grief counselors among them. So be an advocate for end-of-life care wishes. Provide education on the dying process. Oh, I said that one. So the other one is, plan and sit vigil. And during our training a few weeks ago, we talked about sitting, what it means to be holding space with someone as they are dying, which is what a vigil is. You are being there, patient and quiet and gentle and acknowledging, and you might even not be acknowledged by the patient or the family, but you're there anyway to respect this life during this sacred time and know that this is a person who loved and lived and lost. And it's a sacred time. And so being there and understanding that is what vigiling is all about. We did another little exercise at the vigil training, planning our own vigil setting, which was interesting to do. We kind of ran out of time. We didn't have a lot of time to talk about that, but think about that for you, what you may want your space to look like as you're dying. And that really puts you in a vulnerable space, which is what these people are in when they're dying. So, having that gentle, compassionate touch for the vigil. So, and then support families through grief. And that includes anticipatory grief before loved one has died, you're sitting and talking and working with them. My next bullet is just a bunch of asterisks because there's so many other things that doulas can do. Many things that doulas can do at the bedside, you know, as far as in music and things like that. But there are other things that I believe doulas are suited for at the global level. And this may not be the right crowd, but I gotta keep you in here. I gotta draw you in. I do believe that doulas can really help with the gaps in care for the underserved. So that's one of Present for You's part of our mission statement, and I can go into that later if you want to talk about that. The other thing that this asterisk recognizes is that caregivers. So we all know the plight of caregivers, hardest thing that you will ever do. And I think Miss Carter got it right when she said, you know, there are 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. That is the truth. And I think doulas can be very, very helpful in this space. I am currently working with a woman who only speaks Chinese, and her husband is end-stage dementia, nonverbal, bedridden, combative, and she feels a duty to take care of him. And she is exhausting herself. So when I go and visit, I bought some coloring books. And so I go and visit and we sit and color together, a same page of flowers. And I call the language line and we talk through, I'm talking to the phone and the language interpreter, she speaks Mandarin. So we talk that way. And I cannot tell you how many times this woman has been close to tears thanking me for just being there with her in that space and giving her a little bit of time away from that duty that she has for some peace. So I do think caregivers, during my studies, I did a bunch of papers on the plight of caregivers. So I know we can all relate to that. So basically, boils some benefits that I have received, anecdotal, that people have told me that they are comforted by the gentle presence, appreciated the companionship, felt supported and enabled. You know, a lot of people just want to make sure they're doing the right thing because they've never seen anyone die before. Thankful for someone to navigate this unknown. Talking, as I just said, conversations provide respite, absolutely, lessen anxiety. They love the commitment to, family and patient, appreciated the length of time, and thankful for the resources and referrals. So basically, it's about kindness. Kindness can form the bridge that helps a person cross from pain to peace. And you all are part of that as volunteers. And I love volunteers. I'm a volunteer still for various organizations. And I feel like we're all sort of, well, recently someone called me an empathy badass. Sorry for the language, and I think kind of you guys, volunteers in this space and workers in this space are kind of that way. I mean, this is sacred hard work, right? So I love that you guys are volunteering and part of this. Okay, so there are tools. I use guided imagery, which basically is daydreaming. So what I do is I generally talk to a family member if the person is nonverbal and get a story, a memory, a wedding, a granddaughter's wedding, a beach trip or something like that. And then I embellish it and I tell the story to the patient, in graphic detail, and adding to it. And I think that helps, I hope it helps. There's a little bit of, they can think about that memory and make them smile. Some doulas use meditation, aromatherapy, Reiki, massage, and then some doulas are actually even celebrants, funeral celebrants. So that's even gone into that space. Dignity therapy is another tool, and we did this at the Vigil training. We did a modified version. So dignity therapy is just a set of questions, and it's the only evidence-based therapy that has been proven to bring about peace at end of life. And so we did a modified version of this, and that really puts you in a vulnerable position too, thinking about your roles and accomplishments, thinking about what you want to say, what you want to leave behind to your friends and family, words that you haven't said, maybe you can't say, maybe you want to write them down. So I do that. I like doing dignity therapy. I like doing legacy projects. That's kind of my thing here, as a doula has been. And that, when you're written up, can be a legacy project. I've given that to folks after their loved one has passed. Creating videos, even Zoom recordings, which we're doing right now. I had a patient who voluntarily decided to stop eating and drinking, voluntarily stopped eating, VSED, and she wanted me to convene all of her family and friends. And family, family means whatever they define, whatever the patient defines family to be. And so there were friends, family in New Zealand, Australia, Hawaii, Germany, Switzerland, California, and a bunch on the East Coast. So finding a time and organizing the Zoom wasn't a small feat, right? So, but oh my gosh, 2-hour long conversation on Zoom. And she got to say exactly what she wanted to say to all of her loved ones. And I recorded the whole thing, and I took a little snippet of her 20-minute talk where she was describing why she's doing this and what she wanted them to know about it and her life and her legacy and all that. And it was really quite moving and very meaningful. And I sent that little snippet to everyone that was on the call. So organizing pictures, they used to be in boxes under the bed. Now they're online. There's ways to get those organized. Putting together a book of favorite quotes could be either quotes that someone said themselves or quotes that they loved and repeated. My kids tease my husband because he says the same things over and over again all their lives. And so I can just see them putting together this book of dad's favorite, lines. So it's Storyworth. I don't know if you all know about Storyworth. Oh, Storyworth is awesome. You can give this as a gift. It is, they send you 52 questions and you talk with your loved one once a week for a year. And each question is given and it's recorded. And then it's all put into a book, and each question is a chapter. And I have a woman that I'm seeing right now, 88-year-old congestive heart failure. And she did this long before I was around, 2 years ago, with her daughter. Her daughter lived a couple hours away, and they spoke every Sunday afternoon at 5 p.m. for a year. And the book, and now she has macular degeneration, she can't read. And so I'm reading the book back to her. Awesome conversations that come out of that, and the joy that I see in her in remembering these things that she did. There was one trip she took to Argentina with her husband, in 1961, and just some really cool stuff. So I love Storyworth. And then playlists, music. We all know music is very key at end of life, especially those with dementia. And I, from a personal perspective, I have a long line of dementia in my family, so I've already created my dementia playlist, and my children know where it is, so I'm prepared for that. But I do believe, music from the formative years really hits the right place in the brain. The ideas are endless. People are a lot more creative than I am, but this is something that doulas can spend a considerable time doing, which generally the hospice staff don't have time to do that. So I see this as really an augmentation to what the IDT is doing. Okay, so this is an awesome question quote. Can we strive to minimize the suffering inflicted by disease while also embracing more fully the truth that mortality is not a condition medicine should seek to cure? This is from Sunita Puri, That Good Night. Love that book. Is an awesome book. She's a palliative care physician on the West Coast. So here is where I see doulas and hospice and palliative all come together. Hospice is different than other medical specialties, right? We are not in to cure somebody. We know you can't cure mortality. Some other medicine subspecialties don't know that, I don't think. Sometimes I run into oncologists, but I won't speak bad of oncologists. So, but I think this is where we're connected, and I think we can all work together in this space. I think there is plenty of room for doulas in this space to add to the team, to complement the hospice team. And how powerful would it be to have a palliative care NP or MD and a doula go into a home of someone who has not been represented, has not trusted the healthcare system, and someone who is dying, who needs support, or someone who just been diagnosed with a serious illness. So this is what I dream. These are what my dreams are about. Maybe one day, maybe one day. Okay, so here, y'all should know that my company, Present for You, we do have a contract with a local hospice here. It's not Capital Care, it's a smaller hospice here. And we are a lot of the times part of the IDT. And these are some of the things, hospice does and what we do. So hospice, awesome. Symptom management, awesome. That is the best, one of the best things they do. What we can do to supplement that is just having the ongoing observational conversations to see what might really be happening. And it might not just be, symptom pain, just pain symptom. It might be a symptom with the grandson, that maybe the social worker or a clinical, a licensed clinical needs to go in and talk to the son. So we can, help to recognize that and get some extra support. Conversations on goals of care, y'all do that great. Establish a care plan, and then of course legacy. And so what I have seen, even at my time at the hospital, working as a hospital coordinator at VHC, people, when you're discussing hospice and no one's ever heard of it before, they don't get half of what you're saying, and you can repeat it again and they still don't get half of what you're saying. So I think doulas can be really effective with conversations that I call catch-up conversations, because they've heard all this before. I know they have, because they're in hospice and the assessment's been done and all of that, but they still don't understand exactly what the services are and what they aren't. So I feel like, we can really be helpful in that space and explaining hospice. And then of course, I already talked about the legacy projects. We know it's reality. There's limited staff ability. You can't be all places at all times. We can fill in on a consistent basis, for crisis situations and caregiver stress help. So last week with this little contract we have, I got an urgent call about a gentleman who was transitioning, and his son and daughter were having a really hard time. And so I was over there in an hour able to support them. So that's one of the benefits of doulas. Let's see, what do I have here? I can't see this. Depth of relationships with each family member will vary depending on time and situation. What I mean by this is, an RN, maybe every time she goes in, she sees the daughter, right? And she's got a great relationship with the daughter, but the son is not there and he feels he's not getting it. He feels left out. I think a doula can fill in that gap and make sure that they feel part of this too. Talk to the son and get that relationship so you have that one-on-one conversations. And of course, y'all do family meetings. And I just talked about convening a global meeting via Zoom, which, took some time, a lot of time. And then of course, hospice recognizes imminent death, vigil, and so we can sit vigil and be present, volunteers as well. So let me see the next. Oh, and with this contract that we have, I just wanted to quote some of the reasons we've been called in to help with families. And this is kind of interesting. Mrs. A is being referred for doula services for dignity therapy and family support. Mrs. X's daughter is interested in doula support to provide comfort and reinforce goals of care with new paid caregivers. Mr. Z is accepting of doula support and willing to give it a try. His daughter requested it for him because she's concerned that she wants him to have as much psychosocial support through his end-of-life journey. Family seeking doula services to support patient in end-of-life decline for comfort because we can't be there. Patient's family requested end-of-life doula for additional emotional support related to the journey and education on how to talk to small children about death and end-of-life education. So those are some of the quotes from the cases that we've worked on so far. So because of my education within the palliative care space, I'm going to do a little shout out to Present for You here because Catherine said I could. So we believe, we can be effective at onset of diagnosis of serious illness. I think the medical system is really difficult to navigate, and we can help demystify it using simplifying terminology, helping people understand the human issues with life-limiting diseases, right from the get-go. We're trained to have the goals of care conversations, aggressive, comfort, combination, we facilitate completion. We can work on advanced directives and medical powers of attorney and have those discussions. Intentional dual focus on the patients and the caregivers, because the caregivers are near and dear to my heart. Strive for cultural diversity. We have one doula who speaks American Sign Language. We have one who speaks Spanish. So, and we try to, make those connections. We use a technical platform. I don't know if a lot of doulas do that, to input all our data, and we're pulling out data, coming with some metrics to show value. And we refer to hospice at the appropriate time, not too early, hopefully not too late. Well, I see the too late all the time at the hospital. The patients that we get at VHC don't live very long in hospice, and it's too bad. So I leave you with this quote: "You're going to die. Live each day like an embrace, a thank you, and a goodbye." So that's it. Thank you. Any questions?
How many doulas do you have?
I have 4 part-time doulas and me. And I have 3 on a 1099 basis because they have their own doula organizations. So yeah, we're pretty busy. Yes, ma'am.
For the hospice that you contract, does hospice pay for the doula services, or does the family?
Hospice.
Okay.
So, and I can tell you that they pay it through their philanthropy.
Okay.
Yeah. So right now, doulas cannot be paid for by any government money, Medicaid, Medicare, because we are not licensed. So this is a paid through philanthropy. It's a commitment they've made. That actually, one of my clients that I saw for over 2 years, her family requested money to go towards end-of-life doula support in their philanthropy fund, which started this. That's awesome.
Quick question about the cost, because, I'm a social worker.
Right.
And that's something some families don't ever want to engage hospice for whatever reason.
Right.
Maybe they have that experience, or they're just afraid.
Mm-hmm.
So this seems like it would be a great alternative.
Yes.
For families.
Mhm.
What would this cost?
So I have a sliding, I do this because I'm passionate about it. And I have a little bit of money, and not a lot, but I charge, if someone can pay, $95 for the first visit and $75 an hour thereafter. So it could be that I visit someone twice and it's $150. I did see a woman for 2 years. I reduced the rate a whole bunch, to accommodate that. So because I have this little company with these 2 partners who agree, we believe that this is a service that everyone should have. And one of our goals really is we have a potential contract. I can't say too much about it, with an ACO REACH organization, because they can pay, they're value-based, and they can pay for, they can use their money the way that they want to. And they see the value in a doula visit as a preemptive to, ED visits and costly tests down the line. So we're working on that and hoping to sign it next week. So that's another way of income, and the ACO REACH would pay us directly, not involve the patient. But I do have a fair number of private pay clients. I had 2 calls yesterday. There's such a need. And one of them was interesting. And she said, one of the first questions I asked is, well, is your loved one, in this case, it was her mother, on hospice? No, they say she doesn't qualify. And I said, well, tell me about her. 93 years old, late stage congestive heart failure and kidney disease. And I said, what? Who told you? So I'm answering those types of questions and so it's funny because I've been a Capital Caring partner long before y'all even knew I existed, because I was, referring people to Capital Caring as a doula. But like you said, some people don't want to go into hospice, and it has this bad connotation. And I'm trying really hard to my little voice out there, trying hard to change that. But we will help whoever needs help in this space.
Okay, our Zoom friends are asking if
Yeah.
you could repeat the question and then answer it.
Yes.
My question is, a lot of our volunteers are very interested in becoming end-of-life doulas. And you mentioned there's several programs. Can you just speak to that a little bit, what you would advise?
Sure. Catherine asked about that some volunteers are interested in becoming end-of-life doulas, and I had mentioned some educational organizations. The two that I trained with, the INELDA, the International End-of-Life Doula Association, and the University of Vermont has a graduate level certificate in end-of-life doula. So UVM, those are the two that I did. There are many, many others. There's the Institute of Conscious Dying is one out in Colorado. Going with Grace is another one out in LA, which all of these now you can do online. I didn't do mine online. I did mine in person, which I thought was awesome. And I felt like after that weekend, I had, met my tribe and I just felt like I was where I should be. So I don't know how it is online these days. I can't imagine doing it online, but I think it's effective too. So. Yeah.
I did a 3-day.
Oh, yeah.
Crash.
Inelda?
And I, like you, would have rather been in person
Mhm.
to do it because she was at her house, I was at my house.
Yeah.
It was like Friday, Saturday, and Sunday.
Right.
And I'm texting her like, what did she just say? And it's
Uh-huh.
like doing this online
Yeah.
and paying attention. It really took away a little.
Yeah.
But I was thankful that I was able to do it.
Oh, that's awesome.
Yeah.
I'm glad you, yeah.
Time to train.
Right. Yeah. So, and I think what's lacking is mentorship. So my doulas, when they come to work for me, they have had a training, and I don't care which one they did. They've had a training, and then we have further training that I developed based on my palliative care education. So they can answer the questions about the specifics of hospice and things. So, and if they can't, then we know where to go, at least that. So, we have a little bit more education, and we have monthly meetings where we have a grief counselor come and talk, recently I had one of my doulas, which surprised me, was she wanted to really have a 30-minute information session on what it really looks like when you're dying, and what are the different things you can see. So I have a palliative care physician, my partner coming in to do that. So we do have continuing education. So yes, sir.
I've seen doulas kind of as a mixture of a social worker, a chaplain, a grief counselor, kind of all mixed in there together. And I am a grief counselor. I've been a chaplain. I shared with my wife last night, I was coming to this, and that I was interested perhaps in a few years of slowing down in some capacity, but not stopping. And being a death doula would be of interest to me. And she said, well, you can't, you're a man.
Oh.
Address that for me.
Yes, so I have a male doula. Actually, I have two. Actually, three. So my two partners are male. One is a palliative care physician, and he is a doula. He was a doula during COVID. He stopped practicing for a while, and he took the UVM class, and he was a doula. He discovered, though, he's a better physician. So that's another story. And then my other co-partner is a startup attorney, and he's a member of the LGBTQ community, and he took the doula training. He has some lived experience in this space with his father, and he is now a doula as well as a startup attorney. And then I have a gentleman here who's based in Silver Spring, Maryland, who called me up one day, and we had a great conversation, and I hired him. And he has been very effective with men who maybe don't want to talk to women, at this time. It might be too, hard to do. So you would be welcome. You would be welcome. that was a question about men being doulas. And I do see that, women gravitate towards this. I mean, you can see that. But I think we need to diversify a little bit. Yeah. Yes, ma'am.
You mentioned that you could speak more about serving underserved communities.
Right. So what I envision in my dreams here is, there are communities of populations that are underserved. I think of one in particular out in Leesburg, because a Guatemalan population out in Leesburg. And I served one of the members of that community. And I got to know the daughter, and she did not speak English. The daughter did. And the daughter was the one who called me. She's a meditative. She's very spiritual. And her mother was dying far too young, only 59 years old. And I forget what cancer. Anyway, and so I got into that community, and wouldn't it be nice if I had been a Guatemalan doula, right? And I went in there and I knew their customs, their rituals, their traditions, their language, their country, and all of that. And I thought that might have made her go to hospice earlier, her, seek treatment when she was first, diagnosed, someone to be an advocate for her in the medical system who knows about that. So I thought, well, let's go into communities and find leaders and work with the leaders to find people who might want to do this and be representative of those communities. So that's where I see this. I also see this in dual eligibles, which are, people that are both Medicaid and Medicare appropriate. They have both, and generally they have complex illness. There's a lot of complex illness in that group. And so where I see us helping is in the value-based payment system that is being used in palliative. So I can see doulas going in, like my vision of a palliative care NP, MD, and a doula going into homes of the underserved at diagnosis of serious illness, getting a referral from an ACO REACH organization. Hey, this family needs help. Let's, it's not hospice. It's not even pre-hospice, because we can't call it that, because Medicare will get all mad about that. But let's call it supportive connection, a supportive care, or something like that, to go in there and help that type of population, keep them out of the ED as a regular, and reduce costs. These ACO REACH organizations take some risk, right? And so we reduce costs for them, because we're keeping people, keeping families and out of the ED. We're getting them into hospice earlier, so they're getting appropriate care. They're not going into hospice too early, as you read that terrible article in the New York Times where, that hospice was going door to door, signing people up. That's not appropriate either. So I think we can help, my personal opinion is, of course, the medical system is flawed. And I really am worried about end-of-life care in 2030, when there's 73 million Americans over the age of 65. I don't know. I think we need to look for non-traditional ways of helping folks. And I think the medical part is a part of it, and a very important part, but it's a small part. And I think the whole rest of it is really big: the emotional, spiritual, psycho, practical, logistical, and all of that, and the whole caregiver plight. So see, I'm up on my soapbox. I'll get down now, but that's what keeps me up at night. So I don't know if that answers your question.
Well, it's a big question.
It's a big question, and there's lots of answers, and we have been studying this for 2 years now with these, of how we can get into this, into the system. Hospice is medical, right? Even though there's social workers and chaplains and all that, it is a medical specialty. I think one of the superpowers of doulas is that we don't have that medical, beast on our shoulders. We are non-medical, and I think that's a superpower. So that's each person that works in hospice that goes into a home has a role. Doulas can go in and fill gaps and play multiple roles. So I kind of look at doulas as a cross between a social worker, a chaplain, and an eldest daughter. That's kind of the way I look at it. Any other questions? I appreciate you all coming and taking time to listen to me today. Does anyone on Zoom have any questions?
We have one question on Zoom.
Okay,
Um,
or I could probably
the
find,
question is, I'm very interested in voluntary, stopping of eating or drinking for myself. This is the person asking that.
Mhm.
When the time comes. Okay, so how does that choice interface with doulas and hospice care in general?
Great question. So, yeah, I'm interested in VSED for myself when the time comes. How does that choice interface with doulas and hospice care in general? So I believe in a person's autonomy at end of life, and I believe in dignity and respect. And if a person chooses to not take liquid or nutrition to sustain life, then that is their choice. And I have been supportive of people in that role. People that have wanted to do that in the doula role. Usually they've been terminal, you know, and so it's just a matter of time. Hospice, depending on the hospice, they will not be involved in that. And capital caring specifically will not, but they will come in and what I always recommend if someone chooses to do that is that they get on hospice. And once you stop eating and drinking, you become terminal, right? So you can get into hospice, and most hospices will understand that and take you on. And then they would be the ones to manage you, because you may need pain meds, you may need, you know, the comfort meds that go along with hospice. And then they would come and pronounce like they normally do, but you don't pronounce, you know, say they died for medical, you know, for VSED, you died because of their underlying disease is on the, I also support medical aid in dying in DC. Again, it's a person's right to choose. It's all about dignity and respect. And doulas, have been a bedside attendant in those cases where it's legal. So doulas do that as well. Yes.
I was gonna say, as a hospice social worker, I've seen many times our patients make that choice. You know, they're in hospice already.
Right.
And they make that choice.
Right.
Because they're in a place where they've made the decision, you know, their quality of life is not what they want.
Right.
They feel they're suffering. And so I've seen hospice be very supportive of that
Mhm.
from my perspective.
Mhm.
In other words, you know,
Mhm.
meeting them where they were. So
Right.
I'm not exactly sure what you were referring to. I think you're referring to if someone doesn't have an underlying diagnosis.
No, if they're not in hospice already
Okay.
for something, for being terminal,
Okay,
right?
but-
So yeah, absolutely. People, I mean, naturally people stop eating and drinking, right? Yeah.
I
So
wanted to-
sorry. Yeah, I didn't. So if someone is already in hospice, then the hospice is going to be there no matter what.
Right.
And there's no judgment and all of that. And we'll support the person. And, you know, oftentimes we know that this happens at end of life anyway, but some people that are still capable and can make that decision will make the decision earlier on to stop eating and drinking. Yeah.
And it takes a lot of determination to
Mhm.
do that.
Mhm.
And sometimes people choose to do it and can't do it. They change their mind.
That's right. And that is their right up to the very last minute, right? Yep. Mhm. We respect their choices, no judgment. Yeah. So, how do you go about finding clients? Well, interesting. Now that we have this contract with hospice, I am not really actively doing that, but because I've been in the community for so long, I am getting referrals all the time. I go to a lot of the Aging Life Association networking events and things, and have spoken there. And before COVID, did book review, you know, book clubs and spoke at business associations and all of that. So I think all of that work is sort of, you know, now I'm seeing it. So I'm getting calls. People will search for me and find me on the internet. So
Do you have cards or brochures?
I do.
And can you send that presentation to us?
Sure.
I'd like to share it with my team.
Okay, sure. I can send it to Catherine. Yeah.
And we're recording this as well. So
Okay.
Oh,
And I'm seeing a note that says we've skipped a few questions that were above that.
oh, sorry. Okay, we did, didn't we? Okay. Okay. How much does it tell? Yeah, so you can't really make a living doing this. So the people that I've hired either have other jobs or in a position where they don't, this does not need to be their sole income. And I think I don't know if I told you, I worked for 32 years in information technology and retired. And this is supplemental at best. It is not, it would be hard to live in this area as a doula. And there's a couple reasons. One, forgive me, but people die, right? I mean, you don't have consistent clients. You're not going to be seeing the same client over and over for months and months, right? Because they're going to die. So you're always having to get new clients. Plus, this is hard to do. Just like, and you all know that this is hard to do. So I really think kind of the sweet spot here is maybe 4 hours a day doing this. I just don't see, a few times I've done more than that. And, you have to, as we all know, self-care is important and you got to watch out for yourself. So 4 hours, 4 or 5 hours, depending if there's a vigil or whatever. I have spent the night on a hospital floor, on a bed and a mattress before. I don't think I do that today. Maybe I would. I have stayed till 2 a.m. in the morning with a woman who begged me to stay because her dad was dying. So I do that. I do kind of what's needed. But I do have some other people I can call on too. So we can sort of divide it up. But the most clients, patients I've ever had at one time is 9. That's a lot. So, okay. Oh yeah, and I do have, yeah. So that was, they were asking about how many clients, right? And so when I had 9 clients, the other 2 women doula were dealing with 4 or 5 clients. That was all for the hospice we have a contract with. Okay, man can definitely be a doula. I also participated. I'm looking forward to training to be good. And I encourage everyone that calls me that wants to be a doula. I'm like, yes, do it. Because I really just, I see that this is a movement. And I think there's need. So, okay. Did I miss any? Did I get them all, do you think? Okay. Any other questions?
There was one other question.
Thank you all again.
Jane, thank you.
You're welcome.
We will, this is being recorded, so we will send it out and we'll send the PowerPoint out to everyone. But thank you, Jane, very much.
Okay, you're quite welcome. Thank you. So I will stop the Zoom here. Bye, Zoom people.
Bye, thank you.
Thank you.
Mike.
I'm